from a series of interviews with users of the DOAC Dipstick.
I'm Pasquale Pignatelli. I'm a full professor of internal medicine working in Rome at the Sapienza University, and I'm the director of a internal medicine ward and the thrombosis center of our hospital. So we have the opportunity of having a look at a lot of patients. Most of them are outpatients that refer to our clinic for antithrombotic therapy, basically anticoagulant therapy.
What motivated you to use rapid DOAC Dipstick tests?
The initial idea that moved us to test this kind of new tool is that when outpatients in particular refer to our clinic, it is quite difficult to ask them for having a blood test for anticoagulant concentration, but for us it is relevant for several different cases. For instance, patients with a severe obesity, or patients that has a serious intestinal surgery, so that we are not sure concerning the ability or not for these patients to absorb a sufficient quantity of anticoagulant drugs. Many of these patients risk to be moved from a direct anticoagulant drug to the traditional vitamin K antagonist, just because the physicians are not sure about how to manage these patients. And in our environment, asking for a blood test means that you have, for the outpatients patients, the results the week after, because it is not an emergency. We are not in the emergency room. So you make the prescription, patients have to go to a lab, have the test, and come back with the results of the test. The idea that with this kind of tools, with DOACs, we can evaluate at the moment if the concentration in these patients of the anticoagulant drug is sufficient in order to protect them is really intriguing. And this was at the beginning the idea that moved us to connect with you and to try to test these DOACs.
What do patients like about the new testing procedure?
What really makes them happy, honestly, is not the test per se, because this makes the physicians happy, but the idea that I can manage in just one appointment all the strategy for deciding which kind of drug you are entitled to use. Are you entitled to the old drug with a lot of stuff that have to be taken into consideration, or you can use a direct anticoagulant new drug, easier and more handleable for patients? And all these in just one appointment, where you have just to give the direction to the patients to arrive in the hospital without taking the pill. We do the first test, so we are at the bottom of the concentration. Then we ask the patients to take its regular drug. After 2 hours, we take a second test, and in 3 hours, we decide, okay, you continue use this drug. No, probably for you it is better to move for your safety to another drug. So the patient is obviously happier than if you ask them after a first evaluation, okay, I prescribe you a lab test, go to the lab in the hospital or outside the hospital, come back with the results. A second visit is not cost benefit for the hospital, and obviously it is not easy for patients that frequently are old or with disability, with problem. So it is good option for both of us, patients and physicians.
Will smaller hospitals also benefit from the rapid test?
Maybe a small hospital could have also a higher benefit from this kind of tool, in my opinion, because you know that even though the blood test is not a super specialist test, but if you are in a peripheral or little institution, imagine, for instance, in Italy, we have hundreds of little hospitals. The labs in that hospital are not so well organized, and some kind of tests, such as the blood test for DOAC concentration, are not so common nowadays. I know that it is not the ideal because it would be present in every hospital, but the reality is that it's not present at the moment. So maybe having a test that you can take into your room and give to the patients without referring him to a lab or asking to the hospital to send the blood in another hospital, in my opinion, it is another opportunity.
Do you have an example for us?
We have some particular cases that let me think about the utility of this strategy. No later than a couple of weeks ago, for instance, referred to our clinic patients that had a severe surgery. The part of his intestine was removed for a pathology, and this woman had also suffered a deep vein thrombosis, but she is a young woman, and the colleagues that sent her to me asked if she can use a DOAC because he was worried that having just a short intestine, there would be a problem with the drug absorption. And I just explained to this woman to take the last pill in the evening of his drug. Coming in the lab in the morning, we take a sample of urine and did the test, the DOACs test, evaluating the lowest concentration in this woman. Then we asked her to take the pill, wait for 2 hours, and repeat the test. And we observed that in both cases the tests were positive. So the concentration in the blood of this woman was evaluated as sufficient to obtain an anticoagulation status. And we reassured the lady that was really worried about this fact. She, I had a deep vein thrombosis. Are you sure I can use this drug? Because otherwise I can use the old strategy. And this was all resolved in a couple of hours. Without any back and forth, she was confident, and we were confident at the moment.
Where do you see further areas of use for the DOAC Dipstick test?
The idea that outpatients could be tested directly from the physician, also in a peripherally, we can say a peripheral hospital, or in the studio that every physician has, maybe is a good point to imagine. It's a good strategy, in my opinion.
Where do you see the strengths of the DOAC Dipstick for patients with hemorrhages or similar complications?
That's basically the first indication for this kind of test, especially in a situation where it is difficult to perform a blood test. Consider also the problem of the costs. There are several hospitals that don't have any 24-hour lab completely open. And the blood test for the evaluation of the anticoagulants concentration is something that need something more than a usual procedure. So the idea that in the emergency room you can use this test really fast and obtain an answer if patients are with a negative or positive situation concerning their concentration of the drug is obviously something that is really important.